Happy Wednesday. I think. We'll wait for a few people to hop on. Hey, Pam. If you're joining us today, let us know where you're watching from. Hi, Caitlin. Debbie and Jill. Joan. Pretty good crowd. Sue, Ashley, Tammy, Nikki. Tracy. And April. Lisa. All right, guys, we have a good group of you on here, so we're going to go ahead and get started. We have Dr. Tony with us today, and he is going to talk about EPM in horses on how to help prevent it and go over treatment options for it. Be sure to put any questions that you have in the comments. At the end of the segment, one lucky viewer is going to receive a Valley Vet gift card. Or just tell us hello and let us know you're watching with us today. Either way, you will have a chance to win that at the end. And with that, we're going to turn it over to Dr. Tony.
Okay, thank you. Hello, everybody. As I said, we're going to talk about EPM today. So it looks like we've got a pretty good group of people from all over. So I'm excited to talk about this with you guys, and hopefully we can address some questions as they come up. If you have any, please put it in the comment box and I'll get to it as soon as they come up. So EPM, it's a pretty common disease. And if you've had experience with it, then you know exactly what I'm talking about. It's kind of a nasty disease that can affect these horses. So we'll get into some of the statistics about treatment successes and things like that. But first, we'll kind of go over the disease and what it is. It's caused by a protozoa. The official name of the protozoa is Sarcocystis neurona. So you'll probably see that listed in some places. There's also another protozoa, Neospora, that very rarely causes EPM, but it sure can. But it's not nearly as common as the first one. Now, the way that horses pick up EPM is through possums. It cannot be spread from horse to horse, and they can't pick it up from any other animal. Possums become infected with this protozoa, and then they shed the infective stage of the protozoa, the organism, in their feces. And so that feces contaminates hay, contaminates grain, water source, anything that the horse can consume, and then that horse becomes infected. So horse consumes infected possum feces, then that horse is technically infected. Okay. Now, possums, there are other hosts of this organism, this protozoa. And so possums, as they scavenge, can pick up the organism from those other animals, cats, skunks, armadillos, those types of small mammals that can carry this. But those mammals don't directly spread it to the horses. Only possums do. Okay. Once horses are infected, that organism leaves the digestive tract, and then it travels to the central nervous system where it sets up shop and causes a pretty bad infection. Anywhere in the brain, anywhere in the spinal cord is where it likes to settle down. Okay. Now, it's kind of a tricky disease. The good news is that a very small percentage of horses that are actually exposed will become clinically affected. So there are statistically 50 to 60% of horses, according to their blood work, are exposed to EPM, but less than 1% of those that are exposed actually show clinical disease. So that's overall good news. I'm sorry if I mispronounced the name here. Tlin Greg asks, we don't have possums in Arizona, so no concern here. Yeah, I mean, technically, if you don't have possums in Arizona, there's really no way that those horses could become infected with it. I do know that EPM cases have been reported in every state in the United States. So with traveling and those types of things, maybe that's how it got introduced into Arizona. The risk is lower in the Western United States because there are lower possum populations. So good question. So yeah, good news there. Such a low percentage of those that actually get exposed to the organism actually become clinically affected. But for those horses that do become affected, it is a very challenging disease. Since it does affect their central nervous system, they display neurological signs related to their central nervous system. So depending on where that infection takes place is the signs that we're going to see. Okay, large variation in signs, and that relates to where they're infected. Ashley Jean comments. I want to pull this up because it's a good comment. Hay shipped in from other states can cause problems, and that's a good comment there, Ashley. If you have possum fecal contamination on the hay, then those horses could get infected. Yep, and Linda brings up the same point. Yep, good comments there. Okay, so the clinical signs, like I said, large variation. There's no pathognomonic signs, but it's always going to be related to a neurological symptom. Typically, it's asymmetrical, so one side is affected more severely than the other. Okay, but it can be also confused with all of the other diseases that can cause CNS symptoms. Think West Nile, EHV, those types of bugs that can get in there and cause the same things. Caitlin Thomas asks any suggestions on how to keep possums off the property. Yeah, we're going to go over that later. That's a pretty big component of our discussion, so we'll get there, Caitlin. Good question. Stick with us, and we'll get there near the end. Okay. So I'm just going to read off a list here. I printed it out so I didn't leave any out. But these are the symptoms that you're going to see most commonly, and it can be just a few. It can be a combination of several. But again, it just really depends on where that infection takes place. So you can see symptoms related to the gait, a lameness or an incoordinated gait, or kind of stumbling. Okay, they act like they're dizzy. They have a head tilt, weakness. They can have some focal muscle atrophy where they have some muscle loss. Okay, something on the face. If some of their infections in the brain, they can have drooping eyes or ears or a lip. Okay, difficulty swallowing, and worst case kind of seizures or collapse. Really unable to make their way stand up or anything of that sort. Diane asks, how long after infection or consumption of tainted feed until symptoms show up? And that's an excellent question, Diane. Again, such a large variation. There are some cases where they consume the infected feces or feed, and then they become clinical very quickly after. You're talking within 7 days or so. There's also other cases where these horses remain kind of carriers of it, and then something, possibly a stressor or something that pulls that immune system down, even years later, they can develop clinical disease there. So there's no set incubation period or anything of that sort between consumption and clinical disease. Is it true that horses can have EPM and not show signs? Then if they have stress or trauma, can make them show signs? Yes, that is true, Christina. So again, they can kind of serve as carriers where that organism is in their body, but it's just not creating that full-blown infection yet. Okay. And we don't always know what causes clinical disease to become apparent, but usually it's an illness or some other stressful event that maybe drags that immune system down so that that organism can really take off. Good questions. Thanks for putting those down. Sure, keep them coming. Okay, so with those clinical signs, kind of along the same lines of the questions that we've been answering, there seems to be some factors that are very important in determining how severe of an infection that horse has and how quickly it progresses. And there's 4 big ones to think about. Stress is what we've talked about. And stress is important because it affects the immune status of that animal. Okay. The infective dose, that one makes sense. The number of organisms that the horse consumes. Okay. How quickly we start treatment. And then the anatomic location of the infection, whether it's in the brain, what part in the brain, or in the spinal cord. Okay, and another question pops up here. Can a carrier horse pass EPM to a foal? No, it doesn't transmit that way. The only way that it gets passed is from possum feces and consumption of that. Okay, good question. Okay. Diagnosis of this disease is pretty tricky. It's not straightforward. When we talk about 50 to 60% of horses are exposed, that means that their blood work shows that they have antibodies against it. Okay, so when you're trying to diagnose the disease, blood work can tell you whether they've been exposed to it, but 50 to 60% of horses are going to show up positive. So that's not a perfect test. If it comes back negative, you can safely assume that it's not EPM. We have a spinal tap where we can pull cerebrospinal fluid and actually look for the organism or antibodies in the CSF. But of course, that comes with some risks. It's risky to pull that sample. So that's not perfect either. You know, a lot of times treatment is initiated if we suspect EPM, just because it is so essential to get that treatment started early. And a lot of times diagnosis is performed as a diagnosis of exclusion, where we try to diagnose other forms of neurological disease and exclude those as being reasons. Okay. Or we can use response to treatment as a way to help guide our diagnosis. Okay. So we'll kind of move into treatment unless anybody has any questions before we move forward. Okay, so this is kind of a longer question. It'll scroll there as you see, but I'll kind of read it off. It says, I have a horse who has navicular with corrective foot care. He really rarely shows signs of pain anymore. During this process, he became somewhat uncoordinated. Thought it was navicular related, but now I don't know. It has been going on for around 3 years. Could he have EPM for this long without it progressing? That's a good question, Debbie. That's a little bit out of our wheelhouse today. Okay. I'm not really going to offer any diagnostic advice for you today. That's not really our role here. Is dragging back feet a sign, or is horse just lazy? He does not drag while loping. It can be, I mean, it could be a neurological issue. Whether or not it's a sign of EPM, I can't say for certain. But yes, it could be a neurologically related where he has lost some proprioception in that foot. So you might want to speak with your veterinarian about what could be the cause of that symptom that you're seeing. What is the prognosis if a horse is diagnosed? Good question. We were going to get to that, and so that'll lead me into my next points. So statistically, 60 to 70% of horses that we treat aggressively will improve. And that improvement can range to complete recovery to mild improvement, all the way to, you know, being functional horse, but still having some mild neurological signs, similar to, you know, maybe some of that feet dragging, things like that, that we notice, but doesn't affect that horse functionally. May affect them if they're a high performance animal, but they're still able to ambulate, get around, and live kind of a normal life. Okay. Up to 25% of horses will recover completely. On the other end of that, up to 20% of horses can relapse within a 2-year time frame. Okay. Sonny asked a question here. What is aftercare after treatment to regain muscle and strength, supplements, or feed of some sort? So aftercare, after you treat the disease, is going to be supportive. You're going to want to try to help support muscle, muscle growth if they've lost any muscle, and then just really trying to start slow on your training and increase your training. So it's not going to be medication based. It's all going to be kind of physical therapy, if you will. Touch base on relapse. Okay, so a little bit of clarification here. Relapse, if we treat an animal and they improve or even recover, and then after a period of time, whether it's quickly or even a couple years down the road, they could have a relapse where they start showing symptoms again, or the symptoms start to worsen again. And that would be because the organism wasn't completely killed. And so that infection would have started to take hold again. Now, we don't have any way to know which horses are going to relapse, or which horses are even at risk of relapsing, unfortunately. So you're just going to have to monitor your horse for signs of worsening neurological symptoms or for relapse of the same symptoms. Or different. I mean, theoretically, it could be a different set of symptoms as well. Good question, April. So we currently have 3 medications that are labeled specifically for EPM. Marquis is probably the most well-known. We've got one that's very similar to Marquis called Prognosis, and then we've got a third one called Rebalance. Lisa asks, I was told that most horses test positive for EPM. Is that true? Yes, Lisa, that would probably be the blood work that we talked about just a little bit ago. Again, 50 to 60% of horses would have exposure to EPM, and so they would have antibodies in their blood work against EPM. Good question. Okay, so for treatment of EPM, we would want to use a labeled antiprotozoal against EPM, which is the 3 that I just commented. And then we would also want to do some supportive therapies. So this is where you would want to work very closely with your veterinarian. There would be some prescription anti-inflammatories that you'd want to discuss. If there's any kind of supportive care to help your horse get around, or to prevent sores, anything like that, your veterinarian is going to be such a valuable tool and source of information for you. And then another important piece of the therapy is supplemental vitamin E. And this is important because it helps to promote healing of the central nervous tissue. Okay. And so, as you all are probably aware, nervous tissue is very difficult to heal once it's damaged, but vitamin E is the best tool we have to help promote that. Okay. So we're going to talk a little bit more in detail about each of the treatment options. Rebalance is a sulfa combination, sulfadiazine and pyrimethamine. Okay, and it's a liquid, and it's actually labeled for up to 270 days of a length of treatment. Okay, Marquis is a paste form, and currently it's very difficult to come across. I think it's on back order at the manufacturer level. So it is a very popular and very effective medication for EPM. And Prognosis is actually a pelleted form of a medication in the same class as Marquis, and they are both labeled for a 28-day course of treatment. Okay. Now, with Marquis and Protozil, many horses are actually treated for a longer period, generally up to 6 to 8 weeks of a length of treatment time. So you'd want to work with your veterinarian and talk with him or her about the advisability of doing that. Now, generally, the recommendation is to treat as long as you're seeing improvement. So if that's longer than the course that's on the label, then you'd want to get your veterinarian's advice on continuing that treatment for a longer period of time. Okay. Okay, so we had a question earlier about prevention, and that really revolves around controlling those possum populations. So it makes sense to try to control possum populations if you want to work on extermination of them or trapping and relocation. Those would be two options. You want to make sure to relocate them to an area that's far enough away that they won't migrate back. Okay, we'll take a break for a question here. Debbie asks, let me ask my question a different way. Can a horse have mild symptoms, have EPM, and not get any worse over time? Or is EPM a progressive disease without treatment? Okay, so a horse, typically EPM progresses without treatment, most commonly. I'm not going to say it's not possible, though, that a horse can have mild symptoms and not get any worse over time. Good question, Debbie. Okay, so possum population control. That's a very good thing to try to accomplish. But then also we want to try to keep the possums that are present away. They like to come after the feed that we have available. So keep the feed in the feed rooms, keep them in containers that are sealed. Dropped grain, anything like that, sweep it up, pick it up so they don't have anything to come scavenge. Dead critters that possums like to come around and scavenge. Obviously, keep those cleaned up. Keep fresh water available at all times. If you have a higher possum population, you might want to restrict access to groundwater sources because that can be a source of infection. Okay, and then just promoting your horse's overall health to try to help promote a strong immune system so that if they are exposed, hopefully they're in that group that doesn't actually develop clinical disease. So proper nutrition, vaccinations, regular deworming, and regular appointments with your veterinarian to have your horse evaluated. So that's really all I've got. If there are any other questions, I would be happy to address those before I signed off here. No? Okay. Well, thanks for signing in. Stick around because they'll come back on and let us know who won the gift card. Have a great day.
All right. Thank you, Dr. Tony. We have a winner. Someone is going to take home a Valley Vet gift card today. And that person is Lisa Bussey. Woohoo! Congratulations. Congratulations. Alrighty. If you're still watching, go ahead and send us a private message to claim your gift card. Okay. We do have a gift card giveaway that's still going on. Oh, yeah. Let's talk
until
the 23rd. This ends on Friday. So make sure you get entered now. There's going to be 5 winners. Each winner will get a $100 gift card. So get signed up.
And tune in live next Wednesday to see who the lucky winners are.
Yes, we'll be drawing live. So,
all right. And with that, that's all we have for you today.
Everybody have a great afternoon.
Bye.